Which of the following complications is more likely to occur in a man with Klinefelter syndrome? Small stature, type 2 diabetes, improved fertility, or reduced risk of non-Hodgkin lymphoma. So, in Klinefelter syndrome, this is responsible for the male hypogonadism, and it is defined as 2 or more X chromosome, 1 and more Y chromosome in the karyotype. This is a very common condition. 1 into 650 or 1000 live male birth is the incidence of Klinefelter syndrome. Etiology and genetics. There are 3 genetic forms of Klinefelter syndrome. Most of the cases are due to the meiotic non-disjunction in egg or sperm, responsible for the 90% of the cases. A typical 47XXY karyotype is seen in this condition. Mosaic is responsible for some of the cases, and other forms like isochromosome is responsible for the few cases in which these karyotype can be seen. Advanced maternal age is very important risk factor in development of Klinefelter syndrome. Now we will discuss about the clinical features, in which we discuss common clinical feature and the other associated clinical feature and complications of the Klinefelter syndrome. Klinefelter syndrome, what are the common clinical features? Hypogonadism and infertility. Typically, small and firm testes are present in a patient of Klinefelter syndrome, and this is responsible for the delayed puberty, decreased muscle mass and bone density because of the low level of testosterone, decreased facial and body hair, gynecomastia, and low libido. Tall stature because of the extra copy of X chromosome and increased amount of the SOX gene, which is responsible for the growth of the long bone and result into the tall stature. There are developmental delay, slow motor development, speech and language difficulties, learning disabilities, and dyslexia is also noted. In neurocognitive and behavioral disorders, ADHD, anxiety and depression can be seen in a patient of Klinefelter syndrome. And other associated health risk and complication which is seen in Klinefelter syndromes are in person with the Klinefelter syndrome, there is high risk of development of metabolic syndrome, in which there is increased risk of type 2 diabetes mellitus, obesity, hypertension, and increased level of cholesterol. Due to the low level of testosterone, osteoporosis is fairly common in these patients. Autoimmune diseases like SLE, rheumatoid arthritis, and thyroid diseases are fairly common in Klinefelter syndrome. Vascular issues or vascular diseases like deep vein thrombosis, pulmonary embolism, and varicose vein are also seen in the patient of Klinefelter syndrome. Patients of Klinefelter syndromes are on high risk of development of few cancers like male breast cancer, non-Hodgkin lymphoma, lung cancer, and extragonadal germ cell tumors. In diagnosis, prenatal diagnosis can be made by chorionic blood sampling, amniocentesis, and NIPT, in which we use maternal blood and extract the cell-free fetal DNA for the testing. Karyotype analysis is gold standard for confirming the diagnosis postnatally. This is a typical karyotype of a person with Klinefelter syndrome, in which we can see 2 copy of X chromosome is there. For other complications, there are hormonal testing which can help, like low testosterone level, high FSH, and LH level. So this is about Klinefelter syndrome. Thank you. So our answer of that question is type 2 diabetes mellitus. As we have discussed, person of Klinefelter syndrome has tall stature, not short stature, and they have a development of particularly on a high risk to develop metabolic syndrome, in which type 2 diabetes mellitus is there. Due to the small and firm testes, they have decreased fertility, not improved fertility, and they are on high risk to develop non-Hodgkin lymphoma. So the answer is type 2 diabetes mellitus. Thank you.